Hi, I'm Dr. Niveditha, consultant pediatrician and baby ICU specialist.
Hi, I'm Dr. Ashwitha and consultant obstetrician and gynecologist.
When you see those two magical lines in the urine pregnancy test, so which confirms your pregnancy, what do you do next?
Yeah, so today we are here to walk you through the journey of pregnancy, both the mother and the baby aspect. So, for better understanding, we divide the pregnancy into three parts: the first 3 months, the middle 3 months, and the next 3 months. And let me tell you that the first 3 months of your pregnancy is a very crucial time because in these 3 months, the baby's important structures, that is the brain, the heart, the development of these structures, they start taking place. Hence, it's very important that we give you good nutrition, good supplements during the first 3 months.
Definitely agree with you, Dr. Ashwitha, because folic acid ideally has to be started right from the preconceptional period.
Yes, yes.
When the couple is planning for pregnancy, because folic acid has a very important role in development of the central nervous system.
Which means the brain and the spinal cord development.
So it prevents neural tube defects. Neural tube is a small structure, and this neural tube, it remains closed. So any non-closure of the neural tube or disruption in the closed neural tube, which usually happens by 18 to 25 days. So this is the time when the mother is actually not even aware that she's pregnant. So this thing we have to stress on, that folic acid has to be taken right from when you're planning to conceive.
Yes. And generally we give it for the first 3 months as well. So you may ask us that can't I take this folic acid through my diet? You can, and only 5 to 10% will be available through diet. That is why we want to supplement it by a medicine. So next, coming to the scans in the first 3 months, which is the early pregnancy scan. We ask for the scan when the couple confirms pregnancy. This is a very important scan because we want to see for the heartbeat of the baby. We also want to confirm if it's a single baby or if there is twins or triplets. Also, this will help us to date the pregnancy and give the delivery date for the couple. And the next scan is the NT scan, that is the nuchal translucency scan, which is again a time bound scan. We always tell you have to come before 13 plus 6 weeks to do that scan, which will give us an idea about if there is any kind of genetic problem in the baby. Next, we ask for the anomaly scan, which is in the 5th month, which will detail see the baby's structures. Afterwards, it's the growth scan, which comes in your 7th or the 8th month, which will tell the fluid status, the weight of the baby, the growth of the baby, the blood supply from the mother to the baby.
Yeah, maybe one point here. The common misconception is that any anomaly picked up in the anomaly scan, the parents feel we have to go for a termination of pregnancy. So the thing is, there are few isolated anomalies, few normal variants, and these don't require medical termination of pregnancy. There are few confirmatory tests to find out if it is really genetic and if termination of pregnancy is definitely
required or no. Yes, I agree with that. So next, shall we talk about the next 3 months?
Mainly about the common medical disorders which you see during pregnancy.
Yeah, so see, pregnancy has to go on smooth. We have to provide that good environment for the mother, so that the environment can be provided to her baby also. So some common medical conditions, like we see a lot of vomiting, excessive vomiting in the first 3 months. Why this is important? Because mother is not able to take any food, not able to take water also, and she loses a lot of weight. So this will definitely have a impact on the baby.
The most common thing is they say I'm not able to digest food, I'm just vomiting, so my nutrition comes down. And any reduction in the mother's nutrition actually affects the baby. The baby's weight starts coming down. The mother doesn't put on much weight. So I think it's mainly reassuring.
Yeah. We have to treat this excessive vomiting, which we call as hyperemesis. Very important that we treat you. Also, the second thing that we see is the thyroid issues. People do ask, do we really need medicine? Because they have to take it every morning and it continues throughout pregnancy. So why you think it does have a impact on the baby's development when the mother needs thyroid supplement?
Yeah, because you see, thyroid hormone is very crucial for the brain development of the fetus. First 3 months, the baby gets thyroid hormones only from the mother. So the mother should have adequate reserves of thyroid hormone. And if the mother is deficient and we don't supplement the mother with thyroid hormones, then the baby starts getting less thyroid and the brain function starts coming down. And thyroid congenital hypothyroidism is the most preventable cause of mental retardation. There are studies which have shown that babies who are born to mothers who have not been treated with for hypothyroidism, they have an IQ of closely 7 points lesser than babies who are delivered to normal mothers or treated hypothyroid mothers. So hypothyroidism in a baby at birth will be asymptomatic for the first few weeks. We cannot actually identify just by looking at the baby unless it is gross. So this is the importance of treating thyroid in the mother.
Also diabetes in pregnancy, which has to be controlled by diet, exercise. If that is not happening, we do give you medicines or sometimes insulin as well. See, this condition needs aggressive control, the sugars, because the mother can transfer the sugar into her baby, and baby can grow too big, baby can come out prematurely. That means before the due date itself, we might have to deliver the baby, which again has a lot of impact after the birth of the baby.
So babies who are born to diabetic mothers actually have low sugars. They have low calcium levels. They turn out to be a little heavy. So any baby who is large for age can land up with birth injuries. So it's not the sugar which affects only the mother, it affects even the fetus.
Even the baby. So next condition we see is the increase in the blood pressure. It's very important that we check your blood pressure at every visit, and if you have any headache or when the BP goes extremely high, there are some jerky movements that the mother can experience, which we call as eclampsia. These are all very dreaded complications that we see in pregnancy, because again, as I said, we'll have to deliver you early and it will be a premature birth for the baby, and the complications of that can be seen as well.
Yeah, the babies can be more growth restricted, they can be small for their age, low birth weight.
Yes. So these are few common medical conditions that we come across, and we want to actually prevent these by giving awareness to the mother.
Okay, Dr. Ashwitha, what about anemia? Because anemia, if you see right from childhood, adolescent and adulthood, and then they go into pregnancy. It's very common and most underrated medical issue. So what are the effects of anemia?
This is the most common condition, and it can be treated also. So anemia in pregnancy, it's common. As you said, in India the anemia is very common here because of undernutrition or lack of awareness also. So we do supplement with iron tablets, and we ask the patient to take iron rich food in pregnancy. So anemia has to be corrected. Not only it will affect the development of the baby, also during delivery when there is bleeding. So she needs to have good amount of iron before the delivery itself, so that the bleeding gets compensated and she does not land up in any life-threatening situation after that. So it's very essential that you take your iron supplements, calcium supplements that we give you in pregnancy.
And babies who are born to anemic mothers, they tend to be again growth restricted. They are small, low birth weight. They can land up in preterm labor again. And babies who are born to severely anemic mothers, they might not be anemic at birth, but they have very less or no iron reserves at all. And these babies turn out to be anemic in the neonatal period. And then that continues again to the next cycle.
So all this while you've been hearing the maternal part and the fetal part, and you would have realized that how much the mother's environment and the mother's well-being is important for giving a very healthy baby.
Yeah, because the mother and the fetus, they are deeply interconnected. They work as a unit, and each one influence the other. And the conditions under which the baby grows, the fetus grows, the hormonal and the metabolic changes which the mother goes, they all have an impact on the baby. Pregnancy as such is a very physiologically stressful condition for the mother as well as for the fetus. Okay, and not every day in pregnancy is very easy. So they say with every pregnancy we have a birth of a baby. It's not only birth of a baby. A mother is born, parents are born, an entire family is born.
And that's how you influence the society also.
As a obstetrician and a pediatrician, we are happy to guide you through this journey of pregnancy and parenting. In our next video, we'll be discussing about preparation for birth, the process of labor and newborn care. If you want us to discuss any topic in detail, please let us know.
You can also comment in the section so that we can release videos, informative videos about it.
Thank you.
Thank you.